Disclaimer: We Level Up is not promoting the use of Adderall. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Adderall withdrawal symptoms. What is Adderall withdrawal? Adderall is a prescription medication for ADHD, attention deficit hyperactivity disorder, and narcolepsy, sleep disorder. A person abusing this prescription will experience withdrawal symptoms when they stop taking it. Adderall is a stimulant that can cause euphoria when taken inappropriately. It can be addictive, and its side effects can sometimes be life-threatening. One should never assume a drug is safe to use in any quantity or conditions simply because it's prescribed. The generic name of Adderall in both the tablet and the capsule is amphetamine, dextroamphetamine salts. Adderall is a Schedule II controlled substance, as amphetamines have been extensively abused. Tolerance, extreme psychological dependence, and severe social disability have occurred to those who misuse the drug. Addiction to Adderall can cause dangerously rapid weight loss, seizures, hallucinations, and potentially fatal heart problems. Therefore, an Adderall detox is essential to stop the damage caused by the drug before it becomes too late. What is Adderall used for? Adderall should only be used as prescribed by a qualified healthcare professional, as misuse or inappropriate use can lead to serious health risks. Here is a list of some common uses of Adderall. Attention deficit hyperactivity disorder, ADHD. Adderall is often prescribed to help manage symptoms of ADHD, including inattention, hyperactivity, and impulsivity. Narcolepsy. It can be prescribed to treat narcolepsy, a sleep disorder characterized by excessive daytime sleepiness and sudden sleep attacks. Cognitive enhancement. In some cases, Adderall has been used off-label for cognitive enhancement or to improve focus and concentration in people without ADHD. Shift work sleep disorder. Adderall might be used to help individuals with irregular work schedules stay awake and alert during their work hours. Fatigue associated with medical conditions. In certain situations, healthcare professionals may prescribe Adderall to address fatigue related to medical conditions such as multiple sclerosis. Depression augmentation. Adderall might be used as an adjunct to antidepressant therapy to address symptoms of depression that are not fully responsive to traditional treatments. Weight management. Adderall's appetite-suppressing effects have led to its off-label use for short-term weight loss, although this use is controversial and not recommended. Side effects of stopping Adderall. The Adderall withdrawal symptoms can make it hard for users to stop independently. If a person is addicted to this drug quits cold turkey, they will experience symptoms that are the opposite of the drug's effects. These symptoms can include loss of concentration, fatigue, and an unusually slow heartbeat. In addition to Adderall side effects, there are also debilitating symptoms resulting from discontinuing its use and a resulting Adderall withdrawal period. The symptoms may include the following: low energy, inability to focus, dry mouth, tremors, body aches, mood swings, overwhelming anxiety, panic attacks, uncontrollable crying, short-term memory loss, intense cravings, depression. Warnings about withdrawal of Adderall. When someone stops using Adderall and the dopamine flow dries up, the good feelings go with it, causing what's known as a crash. Dopamine is the chemical in charge of regulating what's known as the brain's pleasure centers. This can be incredibly intense if the person misusing Adderall does not have ADHD and is not used to dealing with low dopamine. Because Adderall use is so closely tied to the circuits that control and regulate feelings of happiness and pleasure, Adderall withdrawal symptoms are primarily psychological and mood-related. They do not include many physical symptoms often associated with withdrawal, such as nausea, vomiting, fever, or other flu-like symptoms. Adderall withdrawal timeline. How long do Adderall withdrawals last? Most people will feel better within the first 3 months of functioning without the drug. If you take the time to taper down your dose correctly, the withdrawal should be even more convenient. In the meantime, your Adderall recovery timeline goal should be to manage life to the best of your ability and force yourself to engage in healthy activities to rebuild your dopamine stores. First 36 hours. The first withdrawal signs can appear within the first few hours after the last dose. Many people experience the crash of stimulant withdrawal during this period, marked by intense depression and fatigue. Days 3-5. Symptoms intensify during the first week. Intense feelings of irritability, depression, and fatigue are common. Some people also experience headaches and nightmares. This is typically the height of withdrawal intensity. Days 5-7. Symptoms of withdrawal begin fading after about 5 days. Many people still feel moody and incapable of functioning normally in social settings, but they start feeling better during this time. Minor psychological symptoms, such as mild depression, may continue but are far less severe after this period. Weeks 3-4. How long does it take Adderall withdrawal last? In some cases, people have reported feeling the effects of withdrawal from Adderall weeks after their last dose. This can happen to people with a high tolerance who have been using the drug for over a year. Adderall withdrawal effects with other drugs. The use of other drugs can influence Adderall withdrawal effects. Interactions between Adderall and substances like alcohol, certain antidepressants, or other stimulants can intensify withdrawal symptoms or create new complications. It's crucial to inform medical professionals about any other medications or substances used to ensure a safe and effective withdrawal process from Adderall. Many people without ADHD may abuse Adderall recreationally for its stimulant-associated effects of increased euphoria and energy, which also suppresses the side effects of alcohol and can lead to alcohol poisoning. In recent years, mixing Adderall and alcohol has become an increasingly popular trend among college students. Non-prescription Adderall use is so prevalent on college campuses that college students take dangerously high amounts of it to cram before an exam or stay up all night to write a paper. Managing Adderall withdrawal symptoms. There are no medicines currently recommended to treat stimulant withdrawal. However, there are some things you can do to reduce your discomfort. With the help of your doctor, you may want to consider the following medications. OTC pain relievers. If you are experiencing body aches or bad headaches, consider an over-the-counter OTC painkiller like aspirin, acetaminophen, Tylenol, ibuprofen, Advil, or Excedrin. Sleep aids. If you are having trouble staying or falling asleep, you may want to talk to your doctor about a prescription sleep aid like Ambien. You can also use an OTC antihistamine like Benadryl, not non-drowsy. Antidepressants. If you start taking them in advance, antidepressants might help prevent lingering post-withdrawal depression, but they have not been shown to reduce acute withdrawal symptoms. Anti-anxiety medications. Although these drugs are usually not recommended, especially not in the long term, they may provide some relief for the first few days of withdrawal. If you are experiencing intense irritation, aggression, or aggravation, talk to your doctor about getting a week's worth of a long-acting benzodiazepine like clonazepam, Klonopin. Adderall overdose. An Adderall overdose occurs when an individual takes a higher dose of the medication than their body can safely metabolize. Symptoms of an Adderall overdose can include restlessness, rapid breathing, tremors, confusion, hallucinations, and even seizures. In severe cases, an overdose can lead to high blood pressure, irregular heartbeats, and potentially life-threatening complications such as heart attack or stroke. Overcoming Adderall withdrawal can prove difficult and isolating, as individuals often face challenges quitting on their own and may relapse to ease symptoms or cravings. Nevertheless, with We Level Up NJ's therapeutic support and a strong network, you can navigate amphetamine, dextroamphetamine withdrawal more smoothly and achieve a successful recovery. Should you need rehab assistance, contact We Level Up New Jersey Treatment Advocate anytime, day or night. Each call is private and free. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.